Coming to the most important part regarding shrotas. So in these conditions, there is physiological and anatomical pathways, and also the classical references where there is Shravana Shrodhamsi. This is the part. We have started at 9:05, so we will end at 10:35. Okay. So in these cases, mainly हमने जो पढ़ा है रिगार्डिंग श्रवण श्रोतांसी से, उसमें श्रोतस का लक्षण और फिर उसके साथ साथ श्रोतो निधान कारण, उसमें से कभी कभी क्वेश्चंस मेनली वो पार्ट का पूछ सकते हैं. 1 मिनट. Anyone has any doubt? Okay, fine. Okay, I'll continue. Okay. It's visible, no? Okay. Shravana Shrotamsi, like that it is told. Then other than that one, and other than that one, there are many shrotas which is involved in that Shrota Vimana Adhyaya, and then regarding the Shrotas Paryayas. तो Shrotas Paryayas में से पर्याय कहीं पर भी आते हैं तो वो इंपॉर्टेंट पॉइंट्स में ही आते हैं. तो इसमें आपको श्रोतस नाम सुनते ही थोड़ा कंफ्यूजन आने वाले होते हैं. निकेता, ओके, निकेता आपको कंफ्यूजन आ सकते हैं. निकेता, फिर उसके साथ साथ पंताना एंड नाट्य, ये सभी है दोनों का. बाकी रसवाहिनी, रसायनी, धमनी, इन सभी में ज्यादा कंफ्यूजन नहीं होगा. तो इसलिए निकेता, श्रोतस मतलब ज्यादातर श्रोतस ज्यादातर एक कुटी की तरह आपको याद रख लेना, एक हाउस की तरह आपको याद रख लेना. तो निकेत मतलब निकेत निवास करके हम बोलते हैं ना, निकेत निवास घर का नाम रखते हैं. तो इसलिए आपको निकेत निवास करके याद रखना है ताकि श्रोतस का पर्याय है करके मिल जाए. श्रोतस एक घर की तरह होते हैं करके सोच लेना. फिर इसके साथ साथ पंताना मतलब पंत का निकेत निवास, ऐसे करके याद रख लेना. समृद्ध असमृद्धानी वो सब पॉइंट आपको मिल जाते हैं. फिर इसके साथ साथ आते हैं रिगार्डिंग श्रोतस की स्ट्रक्चर के बारे में है. तो श्रोतस की स्ट्रक्चर में मेनली अहित सेवनात् तानि दुष्टाय रोगाय विशुद्धानि सुखस्य करके ये पार्ट भी आता है. उसके साथ साथ ऑरिफाइसेस ऑफ द श्रोतस, ये सभी माइन्यूट करके लॉटस स्टॉक्स की तरह आते हैं करके है. उसमें भी कॉम्पिटिटिव पॉइंट में ज्यादा इंपॉर्टेंट वाला कुछ नहीं. देन कमिंग टू श्रोतस प्रामुख्यता के बारे में है. तो श्रोतस हम क्यों पढ़ते हैं, क्यों इंपॉर्टेंट होते हैं, उनके बारे में है. तो ज्यादातर श्रोतसाम दुष्टि कारणम व्याधि करके हम बोलते हैं. मेनली व्याधि वगैरह बाकी सभी एरिया में या फिर दोष दुष्टि आते हैं तो भी कभी कभी रोगा डेपिक्ट नहीं होते या फिर लक्षण डेपिक्ट नहीं होते, पर जब वो श्रोतस में आते हैं तब ही वो रोगा करके बाहर आते हैं. तो इसलिए श्रोतस ज्यादातर बॉडी का एबनॉर्मेलिटी दिखाने वाले एक मिरर की तरह वर्क करता है, मैनिफेस्टेशन ऑफ डिसीज की तरह. तो इसलिए ज्यादातर श्रोतस एंड श्रोतस का इंपॉर्टेंस करके ये पार्ट कभी कभी वेरी इंपॉर्टेंट करके पूछ लेता है. फिर आधे रिगार्डिंग आचार्य सारेगा का विमान स्थान में श्रोतस के बारे में एंड श्रोतो दृष्टि प्रगारा के बारे में आता है. श्रोतो दृष्टि प्रगारा में ये पार्ट आपने श्लोका में बाय हार्ट किया होगा. अति प्रवृत्ति, संगा, विमार्गवना, सिराग्रंथया करके आने वाले ये पार्ट है. फिर इसके साथ साथ श्रोतो विद्ध लक्षणा करके आता है. श्रोतो विद्ध लक्षणा में मेनली कंपा, आत्माना, चर्दी, जरा करके इसके पार्ट्स में आते हैं. फिर इसका क्लासिफिकेशन देख लेते हैं तो मेनली बाह्य एंड आभ्यंतरा करके आता है. तो इसमें इंपॉर्टेंटली आपको याद रखना है रिगार्डिंग एक्स्ट्रा करके फीमेल्स में जो बताया ना उसके बारे में याद रखना है. आर्तवा एंड द्वे स्तनवाहिनी दमनी करके इसके बारे में आ जाते हैं. तो आचार्य शारंगधरा ने मेनली 9 बहिर्मुख श्रोतस को इंक्लूड कर दिया है. 9 बहिर्मुख श्रोतस एंड इसके साथ साथ आर्तवे, एकत आर्तवे एंड द्वै स्तनवाहिनी करके वो पार्ट के बारे में भी आपको याद रखना है. फिर आचार्य सारगा के बाकी श्रवी स्रोतस ये पार्ट कौन सा मेंशन नहीं किया है, ये पार्ट के बारे में भी आपको याद रखना है. अस्थि वहां, मज्जा वहां एंड स्वेदा वहां के बारे में भी याद रखना है. फिर प्राण वहां से हम शुरू कर लेते हैं. इतना तक समझ में आ गया? कुछ डाउट है? एनी डाउट? 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 डॉक्टर बाला, डॉक्टर रजिया, डॉक्टर पायल? Doubt? Okay, I don't have any problem with the English, but the thing is that last class, no, I think 2-3 students told it should be explained in English. If that is the case, I can explain in English. But last time, some people had told, that's why I started explaining in Hindi. Razia and Dr. Payal, shall I switch on to English? Okay. Yeah, okay, Dr. Payal, I'll explain. Yeah. Coming to the next part. Yeah. Okay, Dr. Bala. So mainly regarding next part, that is about the Pranavaha Shrotas. So in the Pranavaha Shrotas, 1 minute. Yeah, okay. The voice is clear, no? You don't feel difficulty in the voice, no? The voice is clear? Okay. Yeah, okay, fine. Yeah, okay. Okay, then coming to the next part. Okay. Then coming to the Pranavaha Shrotas. So in the Pranavaha Shrotas, it is told as the Moolasthanas. Mainly, you have to consider the Moolasthanas and the Nidhana and the Vikaras in the correct expression. So first we will go to the Pranavaha Shrotas. The Moolasthana, it is told as Hridaya and Mahashrotas. So in that also you don't have any confusion point because prana is situated in Hridaya and prana is the Mahan thing for our body. That also you can clearly correlate. There will not be any confusion in that part also. And then there is an opinion viewpoint regarding Acharya Shushruta that is about Hridaya and Rasavahi Damani. Hridaya and Rasavahi Damani, it is told. So in that case, Sushruta, it is Hridaya and Rasavahi Damani. Just Rasavahi Damani, you can understand somewhere else because Mahashrotas is explained by Charaka. The question can be asked like, which Acharya has told the Pranavaha Shrotas Moolasthana as Mahashrotas. So Moolasthana and Mahan, Moola Mahan, Mahan Moola, like that you can understand. So you will not have any confusion. Mahan Moola. Mahan Moola. Prana is the Mahan Moola, like that you can understand. Then coming to the Dushti Nidana. In that Dushti Nidana, Dadukshaya, Vegadharana, and then also regarding Rukshahara, and then after that there will be Vyayam. These are the main Dushti Nidhanas where I explained that in that Dushti Nidhana you can easily get Ruksha Bhojana, Dhatukshaya, that will be easily got. So in that one, there is no need to stress on, no need to have a code for that. Pranava Shroto Vikana, in that one there will be Kasa, Shwasa, Hridroga, Raja Ikshma, and Swarabheda is explained there. So in such conditions, you can just understand regarding two diseases, you can understand that two diseases. One is regarding Swarabheda because Pranavaha and Pranavaha, Shrotas, Vikara, and Swarabheda, it is hard to correlate. That is why Swarabheda, you can just understand like Swarabheda, how come it can come. So, when the prana goes, the Swara also goes, like that you can understand. Then coming to the Rajakshma, Hridroga, Kasashwasa. Of course, Pranavaha in that Kasashwasa can come. So that is why there is no difficulty. Then Hridroga and Rajakshma. Okay, that is also fine. Then coming to the Vidya Lakshana. So in the Vidya Lakshana, according to Charaka and Sushruta, there will be prolonged respiration, groaning, bending down, that and all things are there. So that also not much important. Coming to the Udagavaha Shrotas. So in the Pranavaha, important is regarding the synonym part and also regarding the Dushti Nidhana. That are the two important parts. Coming to the Udagavaha Shrotas, so Udaga, the word means itself we can understand. It is regarding the Jalavaha Shrotas, which is explained. So the Moolasthana, which is explained, is Talu and Kloma. That is for Charaka and Sushruta. The same point is explained there. So Kloma Talu, like that you can understand. Ya fir Talu Klo, Tal Klo, aisa karke, like that also you can understand. Tal Klo karke. Tal Klo is a medicine. So Tal Klo is a water medicine, like that also you can understand. Talu and Kloma. With that one, there is Dushti Nidhana, which is explained. In the Dushti Nidhana, it is like the exposure to heat and the indigestion and fear and excessive intake of alcohol and the dry food, which is explained there. So that Dushti Nidhana also not much important. Just you have to understand the Moolasthana is Talu and the Kloma. Then it is regarding the Pranamaha Shroto Vikara. So in the Shroto Vikara, it is regarding Trishna, Shofa, and Prameha. So here you have to understand the Prameha. Prameha you can easily understand. No? In the Prameha Rogi, every time the Prameha Rogi will be going to the bathroom. So bathroom for the urination. The urination is Udaga. Like that you can correlate. Then Shofa, whenever we are telling the swelling, no, swelling is because of water retention. So there also the water retention will come. Trishna is always correlated to the water. No, whenever we comes to Trishna, there will be water intake. So that also you can understand the Pranamaha Shrota Vikara. Then coming to the next part. If you have any doubt, just raise your hand or have a or just leave a message. Okay. Then coming to the Annavaha Shrotas. So, in the Annavaha Shrotas, it is regarding Amashya and Vama Parsha, which is mentioned, and Amashya and Annavahi Damani. Okay, of course, Annavahi Damani and Annavaha Shrotas you can easily correlate, but the correlation part will have difficulty where it is coming as Vama Parsha and Annavaha Shrotas. So the Anna will go through the Vama Parsha, like that you can correlate. Then coming to the Dushti Nidana, it is Ahara. It is always Ahara and Agni. Of course, for the Anna digestion, Ahara and Agni is important. No? So Ahara and Agni is the Dushti Nidana. Then coming to the Dushti Vikara, that is regarding Apimandya, Ajirna, Gulma, and Mukharoga, which is explained. That is regarding the Dushti Vikara. Okay, that also not much important because of the Agni and Ahara, Chardi, Krimi, Amlapitta, all due to Anna only. So that is why that also no need to correlate. Just in this one, Anna Shlokas, you have to take importance like the Amasya and Vama Parsha. Then coming to the Viddha Lakshana, in case of Anna Vahashrotas, if there is a Viddha Lakshana or an injury, what will happen for Charaka and Sushruta? So of course, first part will be Anannabhilasha or Annadvesha, which is explained by both Charaka and Sushruta. Just to have to understand regarding Andyada, Annavaha and Andyada, what correlation it can come. So that may be point you can miss up from your mind. So that is why Andya you can correlate. Andya you can understand that part. Underline that part and keep. Andya can come according with the Lakshana for Sushruta. Then coming to the next part, that is regarding Rasavaha Shrotas. So in the Rasavaha Shrotas, there is Hridaya and Dashadamaniya. Of course, Rasavaha and Hridaya and Dashadamaniya, that also you can correlate. No difficulty in that one. Coming to the Dushti Nidana, there will be heavy, cold, oily food. Okay, that also you can correlate. Viruddhahara and Rasavaha, that also you can correlate. That is also no difficulty. Then coming to the Viddha Lakshana, Rasavaha. And with the Lakshana in that one, there is Moha, Brahmana, and Marana, which is explained. Moha, Brahmana, and Marana. In that one, Brahmana word you can underline because Rasavaha and Brahmana, we cannot easily get that point. So you can correlate like in the case of Rasa, if the Rasa is not proper, the person will get a Brahma, Chitta Brahma, like that you can understand. Okay. Then the next point is regarding Raktavaha Shrotas. So in the Raktavaha Shrotas, Charaka has told regarding Yakrit and Pliha. Yakrit and Pliha, of course, the Rakta, the RBCs, graveyard of RBC, everything is related to the spleen and the liver. So that is why Yakrit and Pliha you can easily understand. In the case of Dushti Nidhana, it is told about the burning sensation part which is explained. And then excessive sun exposure, injury by burn, heat, and the physical trauma which is explained. With the Lakshana, it is the bluish discoloration, fever, burning sensation, and anemia and bleeding. Okay, in that one, you can correlate regarding the first part that is regarding the Dushti Nidhana. In that, the third point is regarding injury by burn, heat, and the physical trauma. Of course, Rakta and burn and heat, maybe there is having a mismatch there. That is why burn, heat, and physical trauma point you can underline. When there is a burn or a heat, of course, the Rakta will go from our body, physical trauma, the Rakta will go. Like that you can understand. Then coming to regarding Viddha Lakshana, in that there will be bluish discoloration. The bluish discoloration, how you can correlate is that whenever there is a excessive blood flow, in that case, there will be anemia. And when the anemia comes, there will be bluish discoloration. Like that you can correlate. Raktavaha Dushti Vikara, in that there will be Masurika, Visarpa, Raktapitta, Vidhriti, and Daha and Arsha, which is explained. So Raktavaha Dushti Vikara, you can understand like Masurika and Visarpa part. Okay. The Masurika and Visarpa, it comes to the Rakta only. then Kamala, then coming to the Mamsavaha Shrotas. So in the Mamsavaha Shrotas, there is a Moolasthana where the Snayu, Twak and Raktavahi Dhamani, which is told. The Snayu, Twacha and Raktavahi Dhamani. So in that cases, the Dushtinidhana will be like intake of Abhishandhi Ahara and heavy food. Just in that important point is regarding Snayu and Twacha. Of course, Twacha is correlated with the Mamsa. That also no difficulty. There is regarding the Dushtinidhana. Dushtinidhana also no problem because it is Abhishandhi Ahara and heavy food and day sleeping can lead to Mamsavaha Shrotas. Vigaras. Okay, that also no difficulty. But the Vidya Lakshana, you have to understand, like there will be cyst, vascular torsion, arsha, and edema. Of course, arsha is mamsa angure, but that also you can get. Edema, mamsa, edema or the water retention will be happening over the mamsa region. Cyst also, okay, you can correlate that part also. Just vascular torsion point you can underline because sometimes the vascular torsion will be given as a question and asked Mamsavaha Shrotas with the Lakshana is which among the following? Like that the question can be asked. Then coming to the Medavaha Shrotas point. So in the Medavaha Shrotas, that is Varunyascha Adhisevana, which is told in the shloka part. So in that one, Vrikka and Vapavahana. Of course, Medas, one of the correlation point is regarding the Vrikka and Vapavahana. Kati and Vrikka, the point is also there. The Dushti Nidana, there is Adhyahara Sevana. Of course, Medas can increase because of Avyayama, Divasapna or Adhyahara Sevana. With the Lakshana, you can understand regarding or underline regarding Swedha Gamana. Of course, Medha, the increased people will have lot of Swedha, sweating from their body. Snigdanga, Talushosha, everything there will be. So that also you can understand. Then just to understand, just to underline the Talushosha part because Talushosha, maybe you not get that point at that instant. So Talushosha you can underline. Then coming to the Astivaha Shrotas. So in the Astivaha Shrotas, it is told as Asti and Janga part, which is explained. So in that part, there will be exercise and the intake of Vadavardhaka Ahara, which is explained. Of course, Asti and Vada is very much related. So there is no confusion in that one. So in the Vidhi Lakshana, it is told like Kesha, Naka and Danda deformity. Asti, Ubadadu, everything is coming. So there is no point. Just the discoloration part, Vaivarneta, you can underline. Because Vaivarneta and Asti, there is little difficulty in correlating. That is why Asti Vaivarneda, it is happening. Whenever there is a Vidya or injury on the Asti, that Asti will be totally discolored. Like that, you can understand. Am I becoming too boring? Are you able to follow? Dr. Payal, Bala, Anju Mukundan, Rituja and Dr. Razia. Are you able to follow? Yeah. I know this point is little bit boring part. Just a kindly, okay. Okay, fine. Then coming to, okay. Then coming to the next point, that is regarding the next Shrotas, that is regarding Majjavaha Shrotas. Majjavaha Shrotas is the most repeatedly asked question. That is why Majjavaha Shrotas is very important part. You can underline that one. So in that one, the Majjavaha, it is told like Viruddhanamcha Sevana. Viruddha Sevana, it should be taken importance. So it is told like Sandhi and Asti Moolasthana, which is told that. Sandhi and Asti Moolasthana, which is told that. So Sandhi and Asti, it is coming for the Majjavaha. And then coming to the Dushti Lakshana, there will be Brahma and Morcha. Of course, Majja, it is the essence. There can be Brahma and Morcha. Okay, then Majjavaha Shroto Dushti Vikara. In that cases, there will be Rajakshma, Vadarakta, Kushta, Sandhivada, Amavada, and Pakshagata, which is told there. So in that conditions, there can be the Majja, Rajakshma. Rajakshma has already come in the cases of Pranamaha Shrotas. It has already come the Dushti Nidhana, Dushti Vigara, the Rajakshma. So that is why the A and B question can come like, which among the following can come in the Dushti Vikaras? So it is Rajakshma part, okay? So Rajyukshma can come there for the Majja and also the Pranavaha Shrotas. Then coming to the most important, that is regarding the Shukravaha Shrotas. So in the Shukravaha Shrotas, mainly Shukradhara Khala, it is always present all over the body. In the last class, we have explained regarding the Ekakala Dhatu Poshana Nyaya and also regarding different Nyaya part. That is why at that time we have explained regarding when the person goes for the fasting. In that case, the Dhatu, Uttara Dhatu protection will not happen. In that case, the full body will be only surviving based on Shukra Dhatu, like that we had told. According to the first Dhatu, Nyaya, this is told as an example. So we are not discussing about that. Then coming to the first, that is regarding the Mula Sthana. Vrshana, Shefa, Sthana, of course, everything is related to Shukra. Okay, Sthana is related with the Shukra. That also you can correlate. Just Susruda Sthana is also mentioned, that you can just underline. So according to Susruda, Shukra comes through Sthana. Like that you can just memorize in your mind so that you don't get confused. Coming to the Dushti Nidhana, in that one, there will be Shastra Shara Agnikarma, intake of Amla Kattu. Oh, that is not so much important. That we can go to the Dushti Lakshana part. So in the Dushti Lakshana part, there will be froth and thin semen, dryness, discoloration, and putrid smell. Of course, when the Shukra gets deranged, there will be always frothy and thin semen, dryness, and discoloration part will always come. So in that way, the Shuddha Shukra Lakshana, which is already told in the case of Shloka part, Spadigavam, Dravam, Snigdam, Madhuram, Madhugandicha, that is all told here. Then coming to the Artavavaha Shrotas. So in the Artavavaha Shrotas, Shukra and Artava is clearly mentioned there. So Acharya Sushruta has mentioned that Artava Moolasthana is Garbhashaya and Artavavaha Dhamini. Of course, that also you can clearly get. There is no confusion. Then coming to the Viddha Lakshana. Of course, Artavavaha Shrotas, any kind of injury is there. The first problem will be regarding the Vandyatva. Okay, Vandyata. And regarding the Haritas, 6 types of Vandya is mentioned. Harita, 6 types of Klybia. So, of course, you have to understand like Harita, 6 Klybia. That is, I think, not discussed for us. So, Harita, 6 types of Klybia is that. So, you have to understand which are the Harita 6 types of Klybia. This will again come when we are discussing the Prasuti part of it. At the time also it can come. So Harita has mentioned regarding 6 main Klybia Lakshana, which is told. So that is regarding Karbakosha Bhanga, Dhatukshaya, Kakavandyata, Anapatya, and also regarding Garbhastrava and also stillbirth conditions and all. In that one, maybe Kakavandya. Kakavandya is told by which Acharya? Like that, the MCQ question can be asked. Kakavandya, which is. But lest Garbhakosha Bhanga, Dhatukshaya and all, there is no much difficulty in that one. So Kakavandya is told by which Acharya? The question can be asked then. So in that cases, according to Harita, there are 6 Klybia which is mentioned, and one among that is regarding Kakavandya. So you have to understand like Harita has a Kaka, a crow in his tent. So that crow gets up at 6 o'clock, something like that you can understand. So Harita ki Kaka gets up at 6 o'clock. Harita Kaka gets up at 6 o'clock, like that you can understand. So Kakavandya is told by Harita, and Harita has again 6 more types of Klybia which is explained. Then coming to the Mutravaha Shrotas. So in the Mutravaha Shrotas, it is told as Shinasya Abhikshatasya, Masti and Vankshana and Masti and Medra. Of course, the Moolasthana, you will get it clearly. Dushti Lakshana, it is told like Atistrushtadama and Atibaddhata and dysuria condition, which is told. Of course, urine frequency and difficulty in urination, of course, it will come in the Mutravaha Shrotas. So there is no difficulty there. Coming to the Dushti Nidhana, Vegadharana and Kshina, because of that, Mutravaha Shrotas will be affected. That also no difficulty in understanding. With the Lakshana, there can be Mutra Nirodha and bladder distension. Of course, that also no difficulty. You can easily correlate that point when it is asked in the MCQ. Then coming to the Purishavaha Shrotas. Shall I ask you one question? Okay. Which among the Vegadharana can lead to Pindigodveshtana? Pindigodveshtana. Which among the following can lead to Pindigodveshtana? Vegadharana can lead to Pindigodveshtana. I'll tell you the options. Yeah, Purusha Vegadharana. Yeah, okay. Right now came up to the Purusha Vegadharana. That is why I told you the question. Yeah, good, Dr. Bala. I think everyone might be knowing the answer. Okay. Then coming to Purishavaha Shrotas, in that one, the important thing is regarding Ajirna. Okay, Ajirna can lead to Purishavaha Shrotas, that you can just underline, because sometimes we can miss that part, Ajirna. So Ajirna can lead to the Purishavaha Shrotas Tushti. Then Adhyashana, Agnimandya, of course, that also can lead to. With the Lakshana, it is Shula, difficulty in passing stools, hard stools, Anaha, Durgandada, that and all you can easily understand. So there also you have no difficulty there. Then coming to the Shvedavaha Shrotas part. So in the Shvedavaha Shrotas part, there is mentioned as the Moolasthana will be Medho and Loma Kupa, which is mentioned. Medas and the Loma Kupa, which is mentioned there. So Sweda can come to the Roma, Medha and the Loma Kupa part. So with that one, there is Dushti Lakshana, which is told there. So Asweda and Adhisweda part is also there, and Parishya and Adish Lakshana part is also there. Maybe in this Vedavaha Shrotas, Dushti Nidhana, in that one, that is regarding Tikshna and Ushna Ahara Sevana. That you can just underline that part. Maybe Svedavaha and Tikshna Ushna Ahara Sevana. It will be difficult to understand. That is why Tikshna Ushna Ahara Sevana can lead to Svedavaha Shrotas problems. Okay. Understood up to this? Any doubt? Understood? We will go to some of the questions part first. Okay. We'll go to the first of the questions part, then we will go to the other parts of it. Okay. Yeah. Okay. Fine. Then we are going to the last part of Kriya part. Almost to the initial part we had covered regarding that one. Then coming to the last part of it regarding the Kriya part. And in that one, we'll deal with some of the modern aspects and the Ahara Parinamagara Bhava, which is explained there. So in that case, okay. And in such cases, mainly this part and all we had covered now. Ahara Parinamakara Bhava, Ahara Pragara, this part is covered. This part is covered. Ahara Parinamakara Bhava and all. Last class. Yeah, okay. Voice is breaking. Okay. This was covered in the last class regarding Ahara Parinamagara Bhava and all. Ahara Parinamagara Bhava and all. Then coming to the modern aspects of it. The modern aspects of this part will be put in the work drive part today night of this class regarding what are the modern parts of it. Till that I will write this part which you are to be did. Okay. Okay. Are you able to see the white screen now? White screen? Okay, fine, okay. So first we will deal with the receptor part, receptors and the mechanical receptors by which we always sense the things. That is called as the receptors. This modern part will be covered in the work drive after this class. Okay. So the classification of receptors, it is all about the mechanoreceptors, chemoreceptors, thermal receptors, and electromagnetic receptors and nociceptors, which is mentioned there. So in the first receptor is about mechanoreceptors, mechanical. Mechanical means something related to the physical thing, that is called as mechanical. The mechanoreceptors means it is always the touch and pressure which is maintained. The touch and also the pressure. So the mechanoreceptors is the touch and pressure which is mentioned. That is the first receptor you have to understand. So mechanical, so touch, when you touch a person or when you give a pressure to a person, it is always the mechanical energy which is working there. That is why mechanoreceptors are the touch and pressure which is mentioned there. Then also regarding the chemoreceptors. Chemo means something related to the chemistry part. My voice is not breaking now, no? It's clear for you? It's clear? Yeah, okay. Fine. The chemoreceptors, this is always the taste and the smell. We always tell, no, there is a chemical energy working between us. There is a chemical thing which is working between the food we take, the smell we take, and also the taste buds of our body. So that is why the chemoreceptors are related with the taste and smell. So chemo, you have to understand it is with the taste and smell which is mentioned. Okay, that also no difficulty in part. No need to write this part, okay? The PDF part will be shared in your work drive. Then coming to the thermal receptors, thermal. I have already mentioned the thermal. We have the thermal energy, kinetic energy and all which is mentioned. Thermos flask, we always tell. The thermos flask always stores the hot water, we always tell. So it is something related with temperature. Thermos is related with the temperature. So thermal receptors, it is with the warm and coldness of the body. So thermoreceptors is the warmth and the cold, warm and cold which is mentioned. Warm and cold which is mentioned for the thermoreceptors. Then the electromagnetic receptors, that is the rods and cones which is mentioned. Rods and cones are present where in our body? I'll give you an option. Nose, ear, eyes, mouth. The rods and cones. Yeah, eyeball. Yeah, correct answer. The eyeball, which is mentioned, the eye size. So in that way, the electromagnetic rays, it is related with the good. Everybody is giving responsive and good thing. The electromagnetic receptors, it is related with the rods and the cones. So this is the thing which is mentioned for the receptors, the rods and the cones. Then coming to the next part, which is regarding the areas of the hearing. The areas of hearing, I have not told you, no? Areas of hearing, skin, vision, what are they? Not dealt, no? Yeah, okay. Shall I deal? I've not dealt with the areas of our body. Yeah, okay, fine. So in that areas of our body, it is told like we always see the things with the help of 17, 18, 19 areas of the brain. We always tell no broadcast areas for the speech. Like that, we always tell no the broadcast area. First, I'll tell with the broadcast area because that is more familiar for you. The broadcast area, which always deal with the speech area. So speech is correlated with the 44. The 44 is with the broadcast speech, which is mentioned. The broadcast speech is in the broadcast area, that is for the speech 44. So you have to tell like the 44 number people will always speak, or the 44 roll number, there was a friend for you, he always speaks. So broadcast was his name. Roll number 44 broadcast always speaks. Like that you can understand. So you will get easily that answer. Then coming to the taste. Taste is related with the post-central gyrus. In that cases, the taste will be having with 1, 2, 3 receptors. There will be 1, 2, and 3 receptors which is mentioned there. So taste. Whenever we taste, what he will tell, 1, 2, 3, taste the food. Like that you have seen in the cookery shows, no? The cookery shows, they will be mentioning like, come on, I'm going to the taste it, I'm going to add this one. So it will be tell like 1, 2, 3. Like that you have to tell. So 1, 2, 3, taste. 1, 2, 3, taste. Like that you have to understand. So 1, 2, 3 is related to the taste, you will understand. Then coming to the vision. Vision is related with the 17, 18, and 19 areas. So 17, 18, 90s are the age where we get the vision. Like 17 age, we will see where we have to go. We have to join the BMS. After BMS, what we will do in the 18, 19 years, we will be in the second year of BMS. Kya hal hoga? What will happen to my life? What will happen to my this thing? So many visionary things will come in the 17, 18, 19. So you have to consider like 17, 18, 19 years are the years of vision, because 17, 18 are related with the vision areas of our brain. The vision is related with the 17, 18, and also with the 19 part. This is about the vision. And then coming to the skin part. The skin part, it is told as 1, 2, 3, and 5, 7. Okay. Already for the taste, we have told 1, 2, 3. So when you want to taste a thing, you will always put some curry in your palm and then you will taste, So where there is contact coming, it is for the skin contact which is coming, the palmar skin is being connected there. That is why the skin will be having connection there. So taste and skin are related, 1, 2, 3, and together with that one, 5, 7 also you can understand. 1, 2, 3, 5, 7 is related with the skin part, okay? 1, 2, 3, and also the 5, 7, which is part with the related with the hearing, related with the skin part. Then coming to the hearing part. The hearing part is told as 41 and 42 age, 41 and 42 parts of the brain. It is related with the audio sensory. It is related with the audio sensory, and the 20, 21 and 22, it is related with the audio psychotic, audio sensory, and also related with the audio psychotic, which is mentioned there. So the 41 and 42, it is with the audio sensory. 20, 21 and 22, it is related with the audio psychotic. These are the things you have to understand. So 41 and 42, if you want to understand, you have to see, like, in the age of 41 and 42, the people will not hear properly, like that you have to understand. Maybe the audio sensation will reduce. So the 41 and 42 are the age for less hearing, like that you can understand. Then coming to some of the chromosomal disorders of our body, okay? I hope this is clear. Coming to the chromosomal abnormalities of our body, okay? So the first chromosomal abnormality is regarding Down's syndrome. So Down syndrome is due to which chromosome? Down syndrome. Yeah, 21 trisomy. So Down's 21. Yeah, 21 is the right answer. 21 is the trisomy 21, like that. So Down's is with the 21. So Down times 21 year is the time of downfall, like that you have to understand. 21 years is the downfall. If you don't want the code, there is no need to go off the code. Then it's regarding Edward syndrome. That is which chromosome? Edward syndrome. Don't see the Google. Yeah, 18. So you have to understand, like, King Edward 18. We always tell, no, King Louis 14 number or Queen Elizabeth 18 number. Like that, we always mention one number together with the name of the king. So that is why you have to understand, like, King Edward 18, the great King Edward 18, like that you have to mention. Then regarding Petau syndrome. What is that? Petau syndrome. Petau syndrome, what is it? Which trisomy is mentioned there? It is trisomy 13, okay? Trisomy of 13th chromosome, which is mentioned there. So what we will tell is that pat the back, we will tell, no? You have to just hold your back. So 13 number is the most, we tell, no, most inauspicious number, like that the 13 is told. So whenever, yeah, okay, it's covered in the previous class. I asked to not covered like that, it is mentioned. Okay, fine. Then we will go to the next part. Do you know who is a super female? Super female. Super female is triple X, yeah. Super male is double XY, which is told there. Okay. We will go to the next part. That is regarding some of the MCQ areas which we will discuss first. Where and all is the colorless urine which is coming. The colorless urine is coming in diabetes mellitus, okay? Diabetes, it is coming as colorless urine. That you can understand. Note it down somewhere. Then coming to the next part regarding pH of the blood. In case of the pH of the blood, if it is 6.9, it will cause death. That is what mentioned. So that and all we can correlate. Then coming to the vitamins and the rickets is covered. The vitamins and the rickets. Vitamins and the rickets part. Yeah, okay, fine. We will go to the hypothyroidism and the hyperthyroidism cases. So in the hypothyroidism, the T3 and T4 will decrease or increase. This is not covered, no? The hypothyroidism and hyperthyroidism. Yeah. In that cases, in the case of hypothyroidism, the T3, T4 will decrease or increase. decrease. One more time, you think hypothyroidism. It is hypothyroidism. Hypothyroidism. Yeah, it's decrease. T3, T4 will decrease and the TSH may increase in such cases. Okay. The main symptom of hypothyroidism is even if the patient will sleep for 14 to 16 hours sleep also, he will feel there is a shortage of sleep. That is the main symptom of hypothyroidism. Okay. And there will be the main symptom of cold intolerance. Maybe the patient cannot tolerate an AC hall or even a cold weather he or she cannot tolerate. That is the first symptom which is told for the hypothyroidism. Maybe you can clinically see that patients see in the patient also. You have to just ask the patient, do you have any problem with the cold intolerance? Maybe the patient can tolerate any amount of hot weather, but he will be very less resistant to the cold atmosphere. So that is the one thing. And then regarding the low BMR will be there, and there will be patchy hair loss. That and all you have seen clinically. And then the main important symptom, which is seen in very less people, is regarding the scaliness of skin, scaly skin. Okay, scaliness of skin, which is skin there. So in that cases, the skin health will reduce, and then the skin will be small scaling, similar to a fishy scale or similar to an old age people. That is why these people will always have a aged skin appearance may be there in the, that is because of the scaled skin appearance. Together that one, there will be bagginess under the eyes and a frog like husky voice. So this can be asked in the MCQ type of question. Which among the following disease condition will have a frog like husky voice, then a bagginess under the eyes? You have seen the frogs. The frogs will be having a baggy appearance under the eyes, no? So for hypothyroidism, you have to always correlate the picture of a frog. Frog like husky voice and frog like bagginess or baggy appearance, like the kapha is stored inside the eyes, like that you can correlate. The bagginess under the eyes will be there. And then regarding the decreased growth of hair, there is no hair part in frog, no? Frog is devoid of hair. So that also can correlate. Then scaly skin. Of course, the frog is having a scaly skin, no? Like that, you have to remember the frog's picture and study hypothyroidism. Understood up to this? Up to this understood? Any doubt? Yeah, okay, okay, fine. Then one more important thing is regarding T3, T4 decrease, and also regarding TSH increase will be there. And it is also called as mixed edema. In adults, it is called as mixed edema. Then hyperthyroidism. Compared to hyperthyroidism is very less asked. Okay, in that hyperthyroidism, the cause will be an autoimmune disease, and because of any kind of autoimmune disorder, a self-destructing disorder, because of that, the hyperthyroidism will be depicted in our body. It may be due to a Graves' disease, that is exophthalmic goiter, or a case of thyrotoxicosis conditions because of that. In that cases, the opposite of hypothyroidism will be there. The patient cannot tolerate the heat. There will be a heat intolerance and the BMR will be increased, and there can be a weight loss and the diarrhea and a muscular weakness and an increased systolic BP will be there in such conditions. And then the eyeballs will be protruded. That is the condition called as exophthalmos condition. These are the things which is found in the cases of hyperthyroidism. Okay, these are the important. Just hypothyroidism you can correlate with the frog. Hyperthyroidism, maybe you might be having any of the relative which is very lean, so you have to consider her as she is having hyperthyroidism. Correlate that symptoms, you will easily get at that one. Hyperparathyroidism, it is due to the formation of kidney stone and the spontaneous fractures will be there and the demineralization. That is all hyperparathyroidism. Hyperparathyroidism is very less asked. Then coming to the parathyroid gland. Okay, you know the thyroid gland. The thyroid gland is a butterfly-shaped gland. On back of it, the parathyroid gland is situated. There are 4 small glands for parathyroid glands. So in that one, you can understand like the para is having how many letters? 4 letters are there. So that is why 4 thyroid glands are for parathyroid gland. Like that you have to, 4 glands are for parathyroid glands that you can correlate. And then with that one, there will be parathormone, or the PTH will be eliminated there. Then regarding hypoparathyroidism, so hypoparathyroidism can arise when the patient has undergone thyroidectomy, removal of thyroid gland, and because of that, hypoparathyroidism can occur. Okay, so this can be asked as an MCQ, where because of thyroidectomy, which among the following disease can be generated in the patient? So in that case, already the thyroid is gone, so there will be hypoparathyroidism. Parathyroidism. Thyroid is got, that is why there will be a parathyroidism. So hypoparathyroidism will be developed if in the cases the thyroidectomy has been done. Then coming to the calcitonin. In the calcitonin, it is synthesized by the parafollicular cells, like that it is mentioned. Then coming to the vitamin D. So vitamin D, there will be a reabsorption from the kidneys. Okay, that is also okay. Then coming to the rickets. Okay, in the rickets, mainly we know the rickets is occurring in children. Okay, in that cases, there will be a deformed bones, there will be rachitic racity, which is mentioned, a short stature of the patient, and there will be a delayed dentition. So delayed dentition can be asked in MCQ. It will be like, delayed dentition is occurring in which of the following cases? One of the causative factor is rickets. Okay, that you have to understand. Delayed dentition and rickets, there is a connection. Delayed dentition and rickets. Okay. Then coming to the osteomalacia. Osteomalacia is in adults, which is mentioned there. Then in the cases of glucagon cells are secreted in pancreas. Alpha cells of pancreas will secrete the glucagon. Insulin will be secreted by beta cells of pancreas. Okay, alpha cells will secrete the glucagon, and the beta cells will secrete the insulin, which is the part which is mentioned. Then the prolactin will be related to the milk secretion in the breast. Okay, prolactin, which hormone is related with the milk ejection? Is it oxytocin or prolactin? Milk ejection. What can it be? Is it prolactin or oxytocin is the correct answer. If the same prolactin, if the same prolactin is there in a male body, so that is the correct answer. In male body, if the same prolactin works, so what may be the change which is observed in a male body? If the prolactin increases, what will be happening in the male body? I'll give you the option. It decreases the testosterone, enhances the testosterone, enhances the breast milk production, or decrease the breast milk production. What can be due to the prolactin in a male person? Decrease the testosterone, enhance the testosterone, decrease the breast milk, or increase the breast milk? Because breast milk appearance can also come in the males, no? You have heard such kind of conditions that may be happening in some males also due to the hormonal increase or decrease. Yeah, in males, what it can be? It doesn't decrease the testosterone, it enhances the testosterone secretion. It's never the decrease, it will be enhancing, not the increasing. It will be helping for more testosterone secretion. So the correct answer will be enhancing the testosterone. That can be also asked in the cases of MCQ question. So you have to understand, it will be enhancing the testosterone in the cases of prolactin condition. Okay. Then coming to the aldosterone. Aldosterone is related with the EGF volume and also with the absorption of sodium, excretion of potassium. These are all related to the aldosterone. Then cortisol. Okay, cortisol, the main function is there, like decreasing the protein synthesis. The protein synthesis will be decreased by cortisol. Then the Cushing syndrome. What causes the Cushing syndrome? Either it is hypersecretion of cortisol, या फिर hyposecretion of cortisol, या फिर hypersecretion of aldosterone, or फिर hyposecretion of aldosterone. What is it? Cushing syndrome. What may be the Cushing syndrome? I hope you understand the question. The Cushing syndrome is caused due to what? Yeah, hypersecretion of cortisol only. So Cushing means you have to understand like the cushion. On top of the cushion, what you will put? You will put a curtain, no? Curtain means cortisol. The Cushing syndrome is related to the curtain like that. You have to understand. The curtain is called as the cortisol. The cushion and curtain. So Cushing and cortisol you can correlate and ask. Then the leptin. Leptin is a hormone which is secreted by the adipose tissue. Leptin hormone. This is the thing which controls the secretion or the appetite. This is controlling the appetite. This is the thing which is told. Okay. Then coming to the next point. Okay. Then coming to the next part, that is regarding which among the following things are not produced by the testis. Testis does not produce dash. Okay. Option is glucose, fructose, estrogen, progesterone. Testis does not produce dash. एक्चुअली इसका आंसर फ्रक्टोज है, बाकी सभी इनअप्रोप्रिएट आंसर है. But it cannot be asked in the MCQ because in such cases there can have an arise confusion. That is why you have to just understand that testis does not produce fructose. Okay, testis doesn't like fruit, like that you can correlate this part. Then coming to which is the secondary storage house for the sperms. Okay, sperms, the secondary storage house for the sperm is which, like that the question can be asked. The secondary storage house for the sperm is the vas deferens. Okay, the vas deferens. The vas deferens can make as a sperm. The sperm can make a vas deferens, no? Like that you have to understand. Vas deferens is the secondary storage for the sperms. That is the secondary storage for sperms. Okay. Then the other one is regarding bulbourethral glands. Actually, in the testis and regarding the sexual contact, which gland provides the lubrication? That is regarding the bulbourethral gland. The testis is similar to a bulby appearance, no? So bulbourethral glands provide the lubrication. Okay, bulbourethral gland. That provides the lubrication. Then is the next part regarding the progesterone. Progesterone, it is responsible for the changes of uterine mucosa. The uterus mucosa and the cells shedding, that is all possible with the progesterone. So that is why the question can be asked like, which hormone is responsible for the changes of uterine mucosa? Because every time the uterine mucosa sheds, new cells arises, new embedded sheath arise, or the layer arise. That is why the progesteronic cells are important. The uterine mucosa's thickness of uterine lining can be increased with the progesterone hormone. Okay. Then, and the other thing is regarding which hormone inhibits ovulation. Inhibiting ovulation. It's progesterone or estrogen. Inhibiting ovulation, which part it is? No, not estrogen. It is progesterone. Okay, it's not progesterone. Inhibiting the ovulation is the effective of progesterone. Yeah, progesterone is the right answer, Dr. Azia. So it will be progesterone. Okay. So you have to many of the time the pills which is done, which is inhibiting the ovulation. That is always the progesterone, POP hormones pills, POP pills like that, which is done. Progesterone only pill, that is called as the POP pill. Okay, POP pill also you will study this again in the Swastavrata aspect. That is called as the POP pill, progesterone only pill. Then regarding the estrogen, okay. Estrogen is related with the motility of the fallopian tube. Mainly the fallopian tube health is always related with the estrogen. And estrogen, the sources are always the ovaries, placenta and all. And regarding protein deposition and in the cases of growth of uterus during pregnancy, that is all a function of estrogen. If there was no estrogen hormone, maybe in the pregnancy, the belly will not grow back. So that is why the growth of uterus, which is happening during the pregnancy, that is always with the estrogen. That also you have to understand. Growth of uterus during pregnancy, that is with the estrogen. Growth of uterus during pregnancy. Okay. That is with this part. Then coming to the testosterone part. So the testosterone, it is with the thickness of skin and secretion of the sebaceous gland, which is told. And that's not much important for the testosterone. Then the urinary system, there is a loop of Henle that is related with the urinary system. That also you have to understand. Then related with the adrenal cortex, that is also fine. Maybe you have seen the dwarfism cases. In the dwarfism, there is decreased growth hormone production during the childhood. That is why the dwarfism is done. And which is the hormone which stimulates the pregnant uterus. Stimulating the pregnant uterus, which is the hormone. Option is oxytocin, prolactin, estrogen, progesterone. What can it be? Stimulating the uterus during pregnancy. Yeah, oxytocin. That is the correct answer. And it is always related with the ejection of milk also. Ejection of milk is also happening because of that. Then some of the abnormal ECG findings also we will see. So in the ECG findings, it is told like when the PR interval, I will draw enter. So when it is like this, there will be PQRST wave which is happening there, and the ECG will go. So in that case, when the PR interval when it is increasing, the PR interval when it is increased, then there will be a conductivity. AV node conduction will be having problem. So it will be the AV node conduction. AV node conduction problem will be there when the PR level is increased. Okay, when the PR level is increased, there will be AV node conduction. This is the first part in the case of PR interval. If the P wave is greater, with great amplitude, it is coming. This part. The P wave is coming with great amplitude, it is growing like this. So in such cases, there will be atrial hypertrophy which is happening there. There will be atrial hypertrophy which is happening here. It will be atrial hypertrophy. Okay. That is in the cases of if the P wave is having a big amplitude, there is atrial hypertrophy. And then is regarding QRS complex. If the QRS complex is having more time, if it is taking more time, the QRS complex is having more time. This is the Q, R, and S. It is having more time. In such cases, there will be bundle branch block. So QRS and BBB, you have to understand here. QRS and BBB, like that you have to understand. So it will be QRS, RS, and also BBB. So bundle branch block, that is happening in the cases of QRS complex. Then there will be depression of ST segment. Okay, depression of ST segment. There will be myocardial ischemia. Okay, ST. We are here. The ST will be there. Here there will be ST segment which is happening there. So in such cases, if the ST segment is little bit depressed, not raised thing, it is little bit depressed thing which is happening here. In such cases, there will be myocardial ischemia. That also you have to understand. There will be myocardial ischemia which is present in my cases. There will be myocardial ischemia which is happening there. Then with the PR interval, if the PR interval is greater than, it is taking more time, about 0.2 seconds it is taking, there will be AV block. Okay, and the QRS complex is taking more time, there will be PRs. This much only you have to understand in the cases of abnormal ECG findings. Understood up to this? Any doubt? Understood? Any doubt? Yeah, okay, fine. Okay, then coming to the next point, that is regarding skeleton cell membrane part is there. Just listen, it is not so important. This the modern part of this PDF will be shared there. So in that one, just to have a look at the first pages of physiology part, which will be shared now. So in that one, there is mentioning about the cytoskeleton, cytoplasm, everything is mentioned. So in that cases, the cell membrane and the cell membrane proteins which are mentioned, just have a quick glance of it. That is only that, a quick glance of it when I share. And then regarding regarding blood, some cases are there. That is not so important, the blood part. The blood part important is regarding in the cases of leukopenia and leukocytosis conditions. In the cases of the TLC, the leukopenia means if the WBCs of the TLCs are below 4,000, that is called as leukopenia. The leukopenia can happen in multiple cases. That you have to understand. Where and all the leukopenia can happen. The leukopenia is happening when the TLC means the total leukocyte count is below 4,000. So that right for you. Leukopenia. The leukopenia will be like if the TLC is below 4,000, okay? Below 4,000 per cubic mm, okay? That is called as leukopenia. And this leukopenia can happen if there is starvation, okay? There is starvation or there is a typhoid fever. In that cases also, the leukopenia can happen. The starvation, typhoid fever, also a viral fever if person is having, or a bone marrow depression. In such all cases, the leukopenia can happen. So the viral fever is there. Then also a bone marrow depression case. Bone marrow depression. These are the things which is happening in the cases of the leukopenia case. Other than that one, there will be a leukocytosis. The leukocytosis is when actually the normal of the TLC, the total leukocyte count is 4,000 to 11,000. That you have seen in your blood reports, no? 4,000 to 11,000. If it exceeds 11,000, it is called as leukocytosis. Okay, it is called as leukocytosis. In the leukocytosis, the TLC will be more than 11,000 per cubic mm. So, and then leukocytosis is happening if the person is having a pregnancy, is undergoing a pregnancy, or is doing lot of exercise, or is undergoing a lot of stress, in such conditions, or if the person is a newborn, or if the person is a newborn, in such cases also the leukocytosis can happen. Or in other physiological parameters also it can be raised, like for example the menstruation, or in the cases of lactation, or in the cases of any kind of infections, the pyogenic infections we tell, no, some infections, in such cases the leukocytosis will be increased. So there will be one pathological condition, that is an infection, and the rest everything is regarding a physiological process, like the pregnancy, menstruation, lactation, or a newborn. And in the cases of exercise and stress also, the leukocytosis will be increased. Other than that one, there is leukemia. Leukemia is a cancerous condition, no? In the leukemia, the TLC will be more than 50,000 per cubic mm. Sorry. There will be more than 50,000, that is called as leukemia condition, that you have seen in the movies and everywhere, the reports. And I'm a leukemia patient. That is the most thing which is repeated in every movies. Okay. Then coming to the T lymphocytes. Okay. T lymphocytes, sometimes the question will be asked with the help of helper T cells and killer T cells. Okay. The T lymphocytes, it is originated from the stem cells. In the bone marrow, the stem cells will be there, and from there only the T lymphocyte is originated. Okay. In the T lymphocytes are having 4 types. One is regarding the helper T cells, or CD4 plus T cells, or inducer T cells. And then other one is regarding killer T cells or cytotoxic T cells. Suppressor T cells is there, and the memory T cells. These are the 4 type of cells which is mentioned. For all the 4 types, there is a code. Okay. The code is H, that is regarding the helper cells. Then the other is regarding killer T cells, HK. Then the other one is regarding the suppressor T cells, and the last one is regarding the memory T cells. So you have to understand, like Hakism like that, or where HK is my SM, like the T lymphocytes we tell, no, T is prepared by Hakism, like that you can understand, because it is all coming under the division of T cells. So that is why T is prepared by Hakism, like that one word you can correlate, or HKSM, or HK shop, the prepared by SM, some S Muhammad, like that you can name, you can include, so that you will get the HKSM, that is the division of the T lymphocyte. Then other than that one, there will be the blood group system. Okay. The blood group system, the important part is regarding which one will be a genotype, an antigen, and antibody, like that. So in that cases, the O group will be having no antigen. There is nil antigen for the O group. That is why it is, which one is the universal donor? Which one is the universal donor? Yeah, okay. That is why there will be no antigen for the O group. So when we ask us which is the universal donor, of course, everyone will get. But sometimes the question can be asked, which blood group is having a which blood group is having nil antigen with 37% incidence. 37% incidence means in a whole 100% population, when we think, in that 37% people will be O group. So that is why O will be having a regarding an antigen nil. There is a nil antigen there. If there is an A blood group, in that one there will be antigen will be A and antibody will be anti-B. Okay, antigen will be A and antibody will be anti-B. In the cases of blood group B, there is antigen B. Okay, and the antibody will be anti-A. Like that it is otherwise. But there will be no antibody for AB. So these two things only you have to understand. There will be nil antigen for AO and nil antibody for AB. Okay, AB group will be having nil antibody. Understood up to this? Any doubt? Any doubt up to this? Clear up to this? Dr. Payal, are you all there? Okay, understood. No. Okay. One more thing we will deal regarding the blood group, and then we will go for the questions part. Maybe you know the research system, RH compatibility group, and yeah, RH incompatibility group will be there. Then the Purpura will be there. The lifespan will be there. So in that cases, the RBC lifespan you have to understand. RBC lifespan, of course, you know there is 120 days. And if the RBC is a transfused RBC, like the person, we have got the RBC from some other words, the donor wise we have got, that is called as a transfused RBC. So when it is coming from outside, the RBC will be having a half lifespan. The half lifespan means it is almost 60 days lifespan will be there. If it is lymphocytes, it will be 100 to 300 days, the lifespan will be there. And the platelet, it is 10 days, which is told. Okay. Then it's regarding bleeding time. How much time the bleeding time will be there? Bleeding time. How much time the bleeding time? It is 1 to 4 minutes, okay? Never forget. And the clotting time will be 4 to 8 minutes. In the cases of snake bite condition and all, the most important laboratory technique which is told is regarding the BT and CT, okay? That is the most important thing which is done. Then there will be tissue macrophages. Tissue macrophages, which is present in 3 parts, okay? Tissue macrophages are present in 3 parts. And that 3 parts are liver, okay? That 3 parts are liver, lungs, and brain. These are the 3 parts where the tissue macrophages will be present, okay? And the liver, it is called as Kupffer cells. So most of the time the question can be asked like, the Kupffer cells are present where, okay? Kupffer cells are present where, that question can be asked. That is regarding the liver. Then coming to the lungs. The lungs are alveolar macrophages, okay? Alveolar macrophages, which is told. Then coming to the brain part. The brain part, the tissue macrophages are called as microglia. Microglia. These are the tissue macrophages. So the tissue macrophages went for an LLB. Like that you have to understand. The LLB is liver, lungs, and the brain part. Okay. Then coming to the ESR part, of course, you know, ESR in male is 3 to 7. And then for the female is 5 to 9. Then for the infants is 0 to 2 mm per hour, like that it is mentioned. Then coming to the smooth muscle. Okay, smooth muscle is not. I think one more class by tomorrow, half part, we can complete the Kriya. And then we will go to the anatomy part. The next anatomy, we'll just, I'll tell you in the group, which will be the next class tomorrow. Okay, up to this, any doubt in today's class? Dr. Bala? Okay. Okay. I'll go to the question part. Yeah, okay. I'll go to the question part. Blood cancer is also known as anemia, sickle cell anemia, neutropenia, leukemia. Just now we have discussed. Yeah, leukemia conditions. Yeah, good. Muhur pravarti. Muhur pravarti lakshana is seen in which condition? Shukravriddhi, Malavriddhi, Raktavriddhi, Shukra and Malavriddhi. In which part the Muhur pravarti lakshana is seen? Muhur pravarti lakshana is seen. Muhur pravarti is seen in the cases of Malavriddhi. When the Malavriddhi is happening, the patient tends to go to toilet many times. Like that, you can just correlate. The Muhur pravarti is seen in the cases of Malavriddhi. Uh, breast milk is rich with dash vitamin. Breast milk is rich with dash vitamin. Vitamin A, vitamin D, vitamin B, or vitamin C. Yeah, vitamin A. That's the correct answer. So you have to tell like breast milk is for the A kid. A kid will always receive the breast milk. A kid will always receive the breast milk. A is for vitamin A. A kid will always receive the breast milk. That will be your code. Right? That will be a kid will receive breast milk. Okay. Okay. That part is fine. Then next is phagocytosis. Maybe the phagocytosis you remember in your biology classes. The phagocytosis is one of the function of which organ? Which organ will be showing the phagocytosis? The options are duodenum, brain, bone marrow, spleen. Duodenum, brain, bone marrow, or the spleen. What can it be? Anyone else want to comment? Yeah, it is the spleen. It's the spleen. Correct answer. Good. Sneha dash janayati. Which this shloka part we had done. Sneha dash janayati. Mardhavam, Shaitilyam, Apakarshadi, Samyoga. Yeah, Sneha Mardhavam janayati. That is the correct answer. Stenson's duct is the duct of this gland. Maybe this we have done in the last class. Stenson's duct is the duct of this gland. Submaxillary, parotid, submandibular, or sublingual gland. Which one is the correct answer? It's a parotid gland, okay? Parotid gland and Stenson's duct. The last question. Swapna is of how many types? Swapna pragara. 3, 5, 6, 7. Swapna is of 7 types, okay? Swapna is of 7 types. Don't forget. Sapta Swapna, like that you can correlate. Deshantara Gati is the lection of which one? Deshantara Gati is the lection of which part? Atma Lakshana, Mana Lakshana, Sharira Lakshana, Panchamahabodha Lakshana. Deshantara Gati. Any guess? Is Atma Lakshana? Yeah, Atma Lakshana is the correct answer. Maybe we can have a confusion when the Atma and Manas is told, because Manas also we can correlate like Deshantara, Manovyapti can happen. But you have to think like the Atma is only having a Gati. Okay, the other one is not having a Gati. Can be Deshantara Vyapana, but it cannot be a Deshantara Gati, because Gati is always for the Atma. Dhatu Poshan Nyaya. First explanation is told by which Acharya? Dhatu Poshana Nyaya. Like this is the only Acharya who has mentioned like this should be there should be a Dhatu Poshana Nyaya and this will be appropriate to help. Like that, the Dhatu Poshana Nyaya is explained by which Acharya? Chakradatta, Dalhana, Sharangadara, Kashyapa. Dhatu Poshana Nyaya is told first time by which Acharya? Chakradatta, Dalhana, Sharangadara, Kashyapa. Which one is that one? Chakradatta is the correct answer. Okay, Chakradatta. Atinidra. If a person does Adinidra and the Kaphavriddhi happens, which thing explains this part? Dravya Samanya, Guna Samanya, Karma Samanya, none of them. Atinidra and Kaphavriddhi. It's Karma Samanya. No, it's Karma Samanya, okay? Because the Adinidra and there is Kaphavriddhi which is happening. So Adinidra is a karma which is you are doing. That is why it's called as Karma Samanya. Yellow color of stool is due to bilirubin, stercobilin, sodium percolate, या फिर urochrome. Yellow color of stool. What can be the answer? Actually, it is stercobilin. Bilirubin is not and all the right answer. That is stercobilin is also there. Okay. Maybe this question will be having a little bit confusion part because in some of the areas bilirubin is also mentioned, but you have to think like stercobilin is also there. Okay. The most abundant type of cells in the epidermis. Epidermis in that one, which is the most abundant type of cells. Adipocytes, fibroblasts, melanocytes, keratinocytes. The most abundant type of cells in the epidermis. It is keratinocytes, okay? Keratinocytes is the most abundant type of cells in epidermis. Okay, coming to the last question. Antigens are present on the surface of RBC, WBC, platelets, plasma. Antigens are present on the surface of RBC, WBC, platelets, plasma. Yeah, RBC is the correct answer. Good. I think you have understood up to this. Any doubt in today's class? Dr. Razia, Dr. Bala, Dr. Anju, and Dr. Rutuja.